Hi, my name is Yehudi. I'm an NHD student at the Department of Computer Science at the University of Manchester, and today I'll be presenting a talk on COVID-19, exploring the consecutive systemic barriers to pathogen-related data sharing during a pandemic. This is talk number 51 for the Data for Policy 2021 conference. My Twitter handle and email are at the bottom of the slides, as is a link to the slides for this talk. So to start with, I'm just going to briefly set the scene. At the time when I authored the abstract for this talk, in March 2021, there were around 122 million confirmed cases of COVID-19. Of those, 2.7 million had resulted in deaths. And by the time we reached August 2021, when I was preparing this talk, there were 206 million confirmed cases and 4.35 million deaths. So the reason I wrote this talk is that last year, when the pandemic was young, in March or April, I worked in a research group where, like many other research groups, we immediately wanted to use our skills to see what we could do around COVID-19 data analysis. As part of this, we discovered that actually it was quite hard to access or reshare certain types of data. And that sort of left me curious what barriers people encountered that meant that they could no longer actually effectively predict or model the pandemic or share analyses that they may have been working on. So I ran a qualitative study with semi-structured interviews. These were Zoom-based interviews. I wanted to know when people were trying to access data, what happened when they had problems accessing it, and what they did when they encountered those barriers. But I also wanted to know about the good bits, the interesting and good data sources, what they did right. And then finally, we asked people, if you could have anything you wanted, what would your dream data source look like? And we also just asked a little bit around the ethics. What concerns did you have or are you aware of around this data? So the first round of interviews was reasonably early in the pandemic during the first and second waves, and I managed 8 interviews. I tried to target people working with non-private data types, such as viral genomics, and I was trying to avoid recruiting people who'd already been working with things like electronic health records, because there's a good reason why those aren't shared. People absolutely deserve personal privacy. I recruited primarily through Twitter and through emailing mailing lists that had computational analysts who were actually working with COVID-19 data. 8 people signed up. And of those people, actually quite a few of them ended up being a mixture of people who were researchers, bioinformaticians, computational epidemic modelers, biologists, and healthcare professionals. Some of them did work with private data as well as non-private data. And the biggest problem I had with this set of recruitment was that everyone who voluntarily signed up from this recruitment methods were from high-income countries, mostly Europe and a few in North America. So we did another round of recruitment, actually, this year. And hopefully this has helped us to expand our set of participants much more effectively. We've managed to get people participating from Asia, Africa, South America, and Australasia, with about a third of the sample from lower and middle income countries. And it now includes civic and governmental data, journalism, people working with national COVID-19 data reporting pipelines, and social inequity in lockdown conditions. When we were designing the study, we were aware that interviews could be quite sensitive because potentially people might express the intent to share or access data they didn't legally have the right to. To mitigate concerns around this, we recorded interviews but sent transcripts of interviews to participants for approval before we reused the content or any quotes. People did make use of this. I had participants say, I didn't actually realize I was a bit too open there, or I was a bit too sassy. If you use that quote, people might be able to identify me. So we had to be pretty careful when we were preparing data. For the rest of this talk, I'm going to speak largely about the thematic analysis for the interview questions from people who participated in round 1. Round 2 of my interviews is still being processed at the moment, so largely this is an interim analysis which will be a bit broader later on. So I've talked a lot about private and non-private data, but I think it might make sense to actually define these a bit more clearly. On the right, I define data with privacy concerns. These are things which, if public, would actually expose a person's location, behavior, or well-being, or some other personal sensitive detail. I'm not referring to data that are kept private for competitive or commercial reasons. Non-private data, like on the left, is data that doesn't expose anything with the specific concerns that I listed earlier, and data that has been shared openly with consent that might otherwise have been considered private. For example, GPS fitness tracker records, and social media posts that have been shared openly. And if I was to put this on a sort of spectrum, I would place some of this data all the way on the right with privacy concerns, things like electronic health records, for example, comorbidity when someone has COVID, but also some other health conditions as well, and personal genomic data. These are all private things. And you'll see on both sides I've put infection, death, and recovery rates. This is because it is very easy when we're in large populations to stay anonymous. If I say there's 400 hospitalizations in England, that's reasonably anonymous. But if we say that there were 3 hospitalizations in a small village, it might actually be quite obvious who we were talking about. On the left of the screen, I list things that are less private. A virus doesn't have the right to keep its genome private. Hospital bed capacities, say an ICU ward, is 70 or 90% full. And in the middle of the spectrum, we have things that kind of fit between this, like social media data and location-based data, which, depending on the content and context, may be more or less private. We also can reflect a bit about the ethical concerns that people shared when talking about these types of data sharing. So on the left, undersharing is a scenario where someone has actually gathered data or done an analysis, and there's no good reason to restrict it, but for some reason it isn't shared or isn't deposited publicly. On the right, we have oversharing. These are things like location data and electronic health records, which has significant re-identification risks. And in some cases, I've even had researchers who've talked about me with scenarios where data was gathered or shared without appropriate consent or controls in place to ensure privacy. So ideally, we want the sweet spot where we're facilitating sharing swift legal data in useful ways, and that when data is private, that it is actually sufficiently and appropriately gatekept with good data sharing arrangements in place. So I will look a little bit at the barriers now that people have found around data sharing. There were 3 primary types of data sharing, which researchers can encounter consecutively. So the first one is actually accessing data in the first place. Once you have access to this data, you may then face challenges using the data because it might not be a good format or designed to be accessed easily. And finally, once you've run your analyses, depending on the permissions associated with that data, you may or may not actually be able to share those resulting analyses onwards, which again limits the utility of your analyses. Let's dig into data access a little bit more. First of all, the first barrier is that you have to know that the data exists. I spoke to a researcher who stumbled on a huge trove of COVID-19 related data that just happened to be on an institutional repository that was largely private that they had access to. As far as they know, it wasn't actually being shared, even though some large amount of it was also non-private data. Then there is gatekeeping around non-private data, where people just habitually default to access control, even if it's not needed. Human throughput becomes a problem in times when there are high demand. So whilst it might be fine if you have 3 data access requests a month, if you suddenly have tens or hundreds of requests because you've suddenly become a critical data source, it's highly unlikely that you're going to be responding to the majority of these requests in a timely manner. Another barrier can be money. Costs can range from free to nominal fees, to at cost, and to even to highly commercial costs in the tens or hundreds of thousands. There's also a time problem here, because if you have to write a grant to request money to access data, then you have to wait for that money to come back, and then you have to actually access the data. It might be weeks or months at each subsequent step. And this is a quote I have from a researcher where they point out that emailing someone and waiting to respond is not always going to be a terribly effective way to actually access data. Second of all is that data may not be designed to be useful. So digging into this a bit further, sometimes we don't have raw data at all, or it's just in an absolutely unsuitable format. For example, it might be that you only have a table on a web page, an image or a graph that has no raw data behind it. Sometimes key figures may come from a PDF, which means that it's not really designed to be read by any sort of computational script. Another challenge is that data often changes format over time. This is usually not a malicious thing. You may realize you need a new column, or that it would be much more efficient if you stored a different file format, or you realize that some other types of data are needed. And so you change it, but it does mean that if you have a script that's designed to run over data files from January, and in February the file changes format, you're going to have a lot of special conditions in your data processing pipeline. It's really important to have computer-friendly ways to access the data, such as APIs. When data is available for humans, but it's not designed to be used for computers, it's fine if it's 50 lines, but if it's 5 million lines or 5,000 or even 500 lines of data, you're going to actually start struggling to analyze it properly. If you're running frequent analyses, you don't want someone to have to go and click on things on the browser or fill out a form before you can get your data. I have a great quote here about how data actually needs context to make sense. This context, this data about data, is known as metadata. And when it's missing, people sort of have to guess at what the story behind the data is, which is not ideal. Some examples might be poorly named or poorly explained columns. Another example might be duplicate columns, where the columns have the same name but different values. Then there's probably some explanation about what's going on, but if that explanation isn't recorded either in the columns themselves or in a file that supplements it somewhere nearby, then researchers will have to guess and potentially misinterpret the data. Another problem may be if raw data is in hidden columns. For example, this is something that could happen in Excel. Another problem that you might find would be missing data provenance. This is where you're wondering where did the data come from, or it may be that the data actually changes without explanation. Once again, this is likely without any serious malice behind this. It's probably innocuous, simply that you've updated your data based on some more recent data files. But if you're using these files and you download it and then actually you download the same file again and it has different content the next day, but there's no explanations about what's going on, then it's a lot harder to trust and actually reuse that data. So here, this is a real proven problem that actually happened in the UK last year in October. There were around 16,000 cases of COVID-19 infections that went unreported because they were stored in an Excel file format. And there were more cases than an XLS could actually support, given the number of columns that was possible in this particular file format. So if you're doing computational modeling, you may also have physical geographical components. And in this case, you'll find that region names often vary and that borders change over time. So unless you know when a file was from, you will actually probably get those boundaries wrong. One of my participants reported that the guide on how to convert data from one geographical region to another came with such a big warning sheet saying that under no circumstances you should actually use it for software that informs policy. But when all you have are changing regions, you really have no choice but to do so in any case. So once you've gotten through the barriers around accessing and using the data, if you actually want to share your analyses, depending on the licenses and permissions that you have for the data that you've received, you may or may not be able to actually share that data. So typically, if you're reusing someone else's data and you run that analysis, it might be that the original data provider says you're allowed to use it, but you're not allowed to redistribute it. If you then want to allow other people to build on your work, you're going to have to leave that hole in the data and hope that they can also access your original data source. Other sources, in some cases, might require approval before sharing your analyses. And another barrier around resharing is if you are mixing data with different privilege levels. That's often very hard or illegal in some cases, depending on the license, to actually reshare. And a frequent comment that we got from people is that when data is actually hard to reuse, it's often not worth the hassle of actually including in analyses at all. And finally, I want to talk a little bit about some of the good examples. So we asked researchers, what are data sources that you've worked with that you've really liked, and can you actually design a dream data source that you'd like to see even if it doesn't exist right now? The biggest recurring theme here was that it's important to design data right from the start to be shared. Explain what's going on and assume that other people will want to reuse your data. So one of the most frequently asked for attributes for a good data source tends to be anticipating desirable filters and making it really easy to query the data. Make it easy for your data users to slice it into the parts that they want to see. This is especially important for really big data. If you have a huge data file with 5 million records, but actually you only want to see a subset of 50,000 records, let's say, then anyone who's using that data is going to be happier if they can just download that subset in a query without having to download the whole file first. Try to preemptively share the data that you have. Don't wait until you're asked for it. For example, Google and Apple released mobility data sets from opt-in mobile phone data sharing. Culture is an important aspect as well. Even in organizations that didn't have the data needed at the start of the pandemic, if they had prior good data culture, they were typically able to pivot quite quickly. It helped if they had data champions who understood why good data was important, as did having data pipelines that made it easy to add new questions into existing pipelines. And in terms of wish list, I think the most recurrent wished for item was being able to link data sources. I think I mentioned earlier that remixing data from multiple sources is problematic, and this could be due to licensing or it could be due to privacy, because the more data you have, the easier it is to typically de-anonymize data sets. It's risky when used for bad reasons, but equally it's very high potential to provide powerful insights for pandemic-related reasons. The second most common thing on people's wish list was the ability to create predictive algorithms using really big data. These are the preliminary findings that I've had from round 1 of my interviews. I plan to do a couple more in round 2, and then create a clearer set of recommendations based on combinations of barriers and the good data sources and wish lists that people shared. If we wish to avoid future unnecessary deaths and long-term instability resulting from pandemics, we must do the following things. We must create technical and social data sharing pipelines that do not rely on human throughput. We must ensure that the data that we have is well documented with metadata, that it's well formatted so both humans and machines can easily access it. We must actively share our data when it is not private and protect the privacy of sensitive data sets. And finally, we must ensure that researchers and data analysts are able to actually legally and safely reshare their analyses and processed data, providing it does not violate privacy concerns. With that, I will say thank you very much to my interview participants, to everyone who helped me recruit my interview participants, and to my supervisors, Professors Caroline J. and Professor Carole Goble. Thank you.